are you today?
Doing good. How are you?
Good. I'm Allison. I'm going to be doing your physical today. What's your name?
My name's Bo.
Okay, I understand that you're here to get into nursing school. You got to get your physical done, right?
That's it. Yep.
All right. Well, before I get started, do you have any questions or concerns?
Mm-mm.
No? All right. Well, so jump on in. I'm going to go ahead and assess your skin. I'm going to assess it for the color, temperature, vascularity, any lesions or anything. Looks good.
Okay.
Okay, I'm going to assess your nails. I'm going to do capillary refill, which should be less than 3 seconds. The color looks good. If you can take your nails like this for me and put them like this is called the Shamrock test. And it assesses for any kind of clubbing or spooning, and the angle should be less than 160 degrees, and it could be a sign of like respiratory distress or anything.
Okay.
Alright, I'm going to come behind you and assess your hair for the color, the texture, any abnormal distribution, excess. I'm going to palpate it. Let me know if you have like any pain or tenderness.
Okay.
Everything good?
Everything's good.
Okay. Okay, I'm going to go ahead and move on to your face. I'm going to palpate areas of your face. Any pain or tenderness? No? Okay. Can I get you to clench your jaws? I'm going to palpate your temporomandibular joint. This is assesses for cranial nerve number 5, which is your, can't remember. Okay, next I'm going to palpate your sinuses. Let me know if you have any tenderness or pain. No, if you did, that would be an indication of a sinus infection.
Okay.
Okay, Okay, moving on from your face, I'm going to inspect your neck. I'm going to give you this glass of water. I'd like you to take a sip and tilt your head back and swallow. Okay, I'm inspecting your tracheal movement to make sure that's working. That is assessing your cranial nerve, number 10, your vagus.
Okay.
Next, I'm just going to palpate your temporal, or your thyroid, sorry. Well, any pain? Good? Okay. I'm going to give you this other glass of water.
Okay.
I'm going to come behind you and assess your thyroid. I'm going to have you lean your head down and to the right. I want you to take a sip of water, and when I say swallow, swallow. Okay, swallow. Good. Okay, same thing, but on the other side. Okay, swallow. Very good.
Okay.
Take this from you. Thank you. Okay, I'm going to palpate your carotid arteries one at a time, because if I did them both, you might pass out, and I don't want that to happen. I'm also going to palpate your temporal. Okay, good. With my stethoscope, I'm going to use the bell to check for breweries on your thyroid, along with your carotid. And your temporal.
Okay.
Okay, sounds good. Okay, moving on from your neck, I'm going to start with your ears. I'm going to palpate your auricle. Everything looks good. I'm going to take the otoscope, and I'm going to pull up and back with your ear and look in to check your temporal membrane. Looks good. It's a pearly gray color. That's normal.
Okay.
Same thing on this side. Looks good. Okay. Can I have you stand up for me real quick? Alright, I'm going to perform a test called the Romberg test. It's testing your balance. I'd like you to put your arms out to the side, close your eyes, and raise one leg. Okay, good. And raise the other leg. Good. Alright, you can sit back down. That tests cranial nerve number 8. your vestibular cochlear. Okay. 2 more tests for the ears. This is called a tuning fork. For the first test, the Weber test, I'm gonna hit it and place it on top of your head, and I want you to tell me if you can hear it in both ears or just one.
Okay. But
Okay. Next, I'm gonna perform the Renee test, and that is air conduction. I'm gonna place it on your mastoid process, and I want you to tell me how long you can feel it. And then after that, I'm gonna put it out in front of your ear and tell me how long you can hear it.
okay.
Okay.
Okay. Okay.
Okay, good. 8 and 19. I'm gonna do it again on this side.
Okay. Okay. Okay.
Good, that one was a little bit better. 10 and 21. Alright, moving on from the ears, I'm going to inspect your nose. I'm going to palpate it just a little bit. Let me know if you have any tenderness or pain. You good?
Yep.
Okay. I'm going to take my pen light. I'd like you to tilt your head back a little bit. I'm going to look up into your nostril, making sure you have turbinate and no deviated septum. Looks good. Okay. I'm going to occlude one side of your nostril. I'd like you to breathe in. Okay, again for this side. Good. Okay.
These guys.
I'm going to now do the smell test.
Okay.
I'd like you to close your eyes.
Okay.
I'm going to occlude one nostril, and I'd like you to take a good whiff of this.
Vanilla.
Yum. Okay. One more time. Close your eyes. Smell.
Big Salve.
Okay, good. And that is testing cranial nerve number 1, olfactory. Okay, moving on from your nose, I'm going to inspect your mouth. I'm going to check your lips to make sure the color is like a nice pinkish red. Has good moisture, no crackling. Okay, I'm going to palpate your lips. Let me know if you have any tenderness. You good? Okay. I'm going to use the pen light and a tongue blade to check your uvula and gag reflex. I'm not actually going to do your gag reflex, but I just want to see it. Open your mouth. Say "aw." Okay. If I were to actually do the gag reflex, that would be checking cranial nerve number 9, glossopharyngeal. Okay. I'm going to inspect your tongue, your teeth, your mucosa on both sides along with the ducts. Looks good. Have you had any lesions or ulcers or anything lately? Okay, good. Okay, now I'm going to perform a fun part, the taste test.
Okay.
I'm going to have you close your eyes. It's going to be 4 different kinds of taste. I'm going to put them on different areas, and I'd like you to tell me what it tastes like.
Okay.
Okay, open.
Salt.
Yes. Okay, open your tongue real far.
Cinnamon.
Mm-hmm. That's a little bit bitter. Again.
Syrup.
Sweet.
Very sweet.
Yum. And then last.
Is it lemon juice?
Yep, sour like
Yep.
a lemon.
Yep.
Alright. Okay, moving on from the mouth. I'm going to assess your eyes. I'm going to start by inspecting each outer eye, making sure that there's clarity.
Mm-hmm.
Good. Good. Okay, the next test, accommodation, I'd like you to look at the pen light and then focus on an object back behind me. Okay, so focus on the pen light,
Mm-hmm.
back behind me. Pen light again, back behind me.
Mm-hmm.
Okay, good. Next I'm going to do, something with a C. I can't remember, but okay, you do this. I'm gonna take my hand right here and put it in between.
Mm-hmm.
I'm gonna shine the light into your pupil and check the other one to make sure that it reacts the same.
Mm-hmm.
Okay, I'm gonna do it again for this side. Okay, good.
Okay.
Okay, next I'm gonna do the Rosenbaum test. I'm gonna have you read this little pamphlet at a comfortable level.
Okay. My deepest fear is that I'll look back on my life and wonder what I did with it.
Okay, good. I'm glad you can read. You should be able to. Okay, I'm gonna have you stand up.
Okay.
I'm gonna do the H test. I'd like you for your eyes just to track the pen.
Okay.
Ready?
Mm-hmm.
Okay, good. Now I'm gonna do a visual field test.
Mm-hmm.
I'd like you to cover the same eye that I'm covering on the same side,
Mm-hmm.
and let me know whenever you see my hand.
See it. See it. See it.
Okay, good. Leave your hand there.
See. Yeah. See it. See it.
Okay, now switch eyes.
Okay.
There you go.
See it. See it. See it.
Okay.
See it. See it. See it.
Okay, good. You can sit back down. Alright, the last test I'm going to do for your eyes is the corneal light reflex. I'm going to shine the light right in between your eyes at your nose, and I should see a little sparkle symmetrically on both eyes. Okay, good. Okay, next I'm going to, on your neck, I forgot to palpate your lymph nodes, so I'm going to go ahead and do that now.
Okay.
Right here, you have your preauricular,
Hmm.
your postauricular,
Okay.
your occipital, your superior cervical chain,
Mm-hmm.
your deep cervical chain,
Hmm.
your supraclavicular, and your infraclavicular. And I don't feel anything, which is normal.
Okay.
Okay. Moving on now, I'm going to do the proximal code. Okay. Okay, so now that I've assessed your upper body right here, I'm going to assess your lungs and your thorax. So if I can get you to stand up for me.
Okay.
Alright, go ahead and turn around.
All
I'm going to palpate the areas of your back, the posterior.
Mm-hmm.
Do you have any pain or tenderness?
Nope.
No, you're good. Okay, now I'm going to percuss. Okay. So I'm gonna explain to you the normal breath sounds. Anteriorly in your front, you have your tracheal, which is right here, your bronchial, vesicular, and vesicular. I'm not gonna auscultate those, I'm just gonna auscultate on your back. So if you wanna go ahead and turn around for me. I'm gonna auscultate with both the diaphragm and the bell on each side.
Okay.
So I'm going to begin with the bronchial. Taking deep breaths a little bit. Okay, now with the bell. Okay, good. Alright. And then I'm gonna place my hands, you can say,
Okay.
isn't
Okay.
it?
Okay.
I'm gonna place my hands right here to check for the symmetry of your lung expansion.
Mhm.
So I'm gonna have you take a deep breath in and then exhale. Okay, good. Your lungs look even. Alright, you can go ahead and sit down. Okay. Two more things that we're gonna do for your lung sounds. First, I'm gonna do tactile, and that is I'm gonna place the palm on my hand, and I want you to say 99 every single time you hear my hand.
Okay.
Alright, ready?
Yep.
Go ahead.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, good. Next, I'm gonna perform agophony. I want you to say E every time I place my stethoscope right here, okay?
Okay. E. 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 E.
Okay, good. If you were to have any type of fluid in your lungs, it would sound more like an A.
Mm.
Okay. You can go ahead and lay down. I'm going to now assess your heart.
Okay.
I'm gonna comfortable.
Oh yeah.
I'm gonna begin by palpating your chest, letting you know if you have any pain or tenderness.
Okay.
You good?
Yep.
Okay.
No pain, no tenderness.
Good to hear. Alright, with pieces of tape, I'm going to mark each of your main artery valves. So I'm going to begin with the aortic, which is in the second intercostal space on the right side of the sternum. And I'm going to do the pulmonic, which again is in the second intercostal space on the left sternal border. I'm going to do Erb's point, which is the third intercostal space, again on the left sternal border. And then I'm going to move down to the fourth, which is the mitral on the left sternal border.
Okay.
And then last is the tricuspid, which is on the fifth, intercostal space on the mid-clavicular line of the left side. Okay, I'm going to auscultate with the diaphragm for normal heart sounds, and then I'm also going to use the bell to assess for any type of murmurs.
Okay.
Sounds good. Alright, your heart sounds good. And in your aortic and pulmonic, the S2 sound should be louder than the S1.
Mhm.
The urge point, it should be neutral, and then in the mitral and tricuspid, S1 should be louder than S2.
Okay.
Okay. Moving on from the heart, I'm going to do your abdomen. Do you mind if I lift up your shirt a little bit?
That's fine.
Okay.
Yeah.
You good? Wait, forgot one thing. Along with assessing the heart, you have to assess the arteries. So I've already done your temporal and your carotid. So I'm going to do your brachial. See your arm.
That's false.
Alright, I'm going to assess your pulses. Good. This side. Then your radial. Your dorsal, pedis, and your posterior tibialis. Okay. I'm gonna go ahead and do the abdomen. Lift up your shirt for me. Okay, I'm gonna begin by dividing the abdomen into four quadrants, starting from the umbilicus, starting with the left upper quadrant, the left lower, right lower, and right upper. I'm gonna auscultate each of them for vowel sounds.
There's plenty of them right now. I'm hungry.
Me too. Oh yeah, we got that gurgling.
Yeah.
Okay, good. I'm gonna palpate your abdomen. Let me know if you have any pain or tenderness.
Nope.
Nope.
Mm.
Okay. I'm gonna look at eye level to make sure that there's any type of pulsations or peristalsis. Okay. I am going to then check the arteries that are in your abdomen, starting with the aortic, which is up here. Then you have the two renals on each side, and the iliacs, and then the femorals, which I'm not going to do. Now I'm going to use the bell to check for bruise. And I don't hear anything, so that's good. Okay. I'm going to palpate and percuss for the liver to find the liver border. So I'm going to begin by percussing, starting at the umbilical and moving forward until I hear a sound change. is a piece of tape. I'm going to start at the 4th intercostal space and move my way downwards until I hear a sound change again. Okay. And the liver normally is anywhere from 2 to 4 inches. So I'm going to go ahead and measure yours, and yours is about 3.5. So that's normal.
Good.
Alright. Next, I'm going to lightly palpate your liver and your spleen. So with my hand, I'm going to put my hand under here, and with my other hand, I'm going to ask you to deep breathly, and exhale. Okay. And then again for the spleen, take a deep breath. Good. Alright, I don't feel them, so that's normal. Move this tape for you. Okay, so that's the abdomen. You can go ahead and sit up if you'd like. Okay, I'm going to assess your neuro now. I'm going to start with your alert and oriented times 3.
Okay.
So what is your name?
Bo Cersei.
Where are you?
Nursing building.
Do you know what day it is?
Monday.
Okay, good. I'm gonna test your recent memory. I'm gonna tell you 3 words, and then I'm gonna ask you later to remember them and say them. So I'm gonna do white, red, and blue.
Okay.
Got it?
White, red, blue.
Got it. Okay. I'm gonna test your past memory. So what is your birthday?
9/22/88.
Okay. I'm going to test your. You said it wrong, but your recent memory now. So who is the president?
Barack Obama.
Barack Obama. Okay. I'm gonna test your judgment. So if you found a envelope that was stamped on the ground, what would you do with it?
Mail it.
Mail it? Okay. And then abstract thinking. What does it mean to not put all of your eggs in one basket?
Diversify
Okay.
things.
Alright, good. And then what were those 3 words that I asked you earlier?
Red, white, and blue.
Okay. Alright, next I'm going to test your cerebellar functioning. When you walked in, I noticed your gait was good, and then we already performed the Romberg test, which tested your balance. So I'm going to ask you to stand up to do one more test.
Okay.
I'd like you to walk here and back with your heel to toe,
Okay.
just like that.
All right. Far enough?
Yep, that's good. You can come back. Alright, good. Okay, you can go ahead and sit down again. Alright, with your fingers, I want you to touch your thumb to each one of your fingers, making it faster each time you do it. Okay, good. And for your legs, one leg at a time, I'd like you to make a figure 8. Okay, good. And then this one. Alright, good. Okay, now I'm going to perform a sensory test. I'm going to have you close your eyes, and I'm going to take this little cotton ball, and I'm going to touch you in it, and I'm going to tell me when you can feel it, okay?
Okay. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Good. Okay. Again, I'm going to have you close your eyes, but I'm going to do a dull and sharp test. This
Okay.
is dull, and this is sharp.
Okay.
So I want you to differentiate between the two when I tell you, when I
Okay.
poke you. Ready?
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Okay, good. Okay, next I'm going to do 3 discriminatory tests. I'm going to start with stereognosis. I'm going to have you close your eyes and open your hands. I'm going to place an item in one of your hands. I'm going to ask you to tell me what it is.
Okay. That's a key.
Good. Okay, and then same thing with your other hand.
It's a colon.
Good. Okay. Next, I'm going to perform graphesthesia. I'm going to have you close your eyes and hold out your hands. I'm going to write something in one of your hands, then the other, and I want you to tell me what I'm writing.
Okay. A.
Good.
Z or 5. Z.
2.
2.
Okay.
Okay.
It's okay. And then last, I'm going to do kinesthesia, and I'm just going to touch you in certain parts of your body and just tell me the general location.
Okay.
Okay.
Shoulder. Elbow. Knee. Hand. Foot. Toe.
Okay, good. And last for the neuro, I'm going to assess your reflexes. So I'd like you to just gently relax your arm. I'll hold it up for you. I'm going to first assess your triceps.
Okay.
Not much going on there.
Not a whole lot going on.
Okay, I'm going to do the triceps on this side as well. Just relax your arm. I'm going to start working out a little bit more. Okay, and I'm going to do your brachial.
Okay.
Biceps, yep. Not much going on there
Not much
either.
going on there either.
These are hard ones to get. Alright. I'm going to pull this table over and I'm going to have you set your forearm on it so I can test your brachioradialis.
Okay.
Okay, there. I want to hurt you. Okay. And then the next one. Good.
Yeah.
Alrighty.
Okay.
Now I'm going to do 2 more. Your patellar and your Achilles.
Okay.
Alright.
See
Just
if-
relax
see if you
your
can do this
leg.
one.
A little
there.
bit. There's a little bit of
A little bit
movement.
there.
Alrighty.
Oh,
Oh
yeah.
yeah. Just got to hit a little bit harder. There you go.
There you go.
Okay. Now for your Achilles, I'm going to ask you to stand up and sit in the chair, but with your knees sitting in the chair.
Okay.
Your legs hanging off. Alrighty. You ready?
Mm-hmm.
Alright. Good. Those have been the best ones yet.
Alright.
Alright. Alright, so that was it for neuro. And then the last part of the physical assessment, I'm going to do muscular.
Okay.
So I'm going to begin by assessing your posture, which you have good posture. I'm going to palpate all your joints and your muscles. Your elbows. Nice and strong. Knees. Ankles. Good. Okay. I'd like you to perform a few range of motion.
Okay.
So I'm going to have you put your arms out like this. Over your head. Bring them down. And down. Okay, good. Can you lift up your leg? Bring it towards your chest. Bend it out your knee. Same thing for this one. Okay, good. Fine and okay, I'm gonna go ahead and have you stand up
Okay.
and I'm gonna assess your spine.
Okay.
So go ahead and bend over.
Alright.
I'm gonna feel it all the way from your neck down. It's in line. Good. Okay, you can stand back up and there's one more thing. Okay. I got it. Alright, so I want you to take your arms like this
Mm-hmm.
and don't let me pull them out. Pull them towards you.
Okay.
Okay, same thing. Now push out.
Okay.
Alright, now same thing with your legs. Pull
Okay.
in. Okay, and push out. Good. Alright, well, that concludes the physical assessment.
Okay.
Do you have any questions? Anything else?
Nope.
So everything's good?
Did a good job.
Alright, I think you're ready for school.
Okay.